So cancer patients and activists will this morning march to the Gauteng Health Department. This is to present a memorandum of demands. They demand that the department spends the 784 million rand set aside by Gauteng treasury on radiation oncology services. This is for the benefit of over 3,000 patients who are currently on the backlog list. Some patients say they've been waiting years for treatment. Or Treatment Action Campaign Gauteng chairperson Monwabisi Mbasa joins us now to chat some more on this issue. Monwabisi, good morning to you. Thank you so much for joining us. Okay, I've given just some of the issues that you guys are raising. 784 million rand that you want to be spent on oncology services. But in your words, explain why this is an important march for you to embark on.
Thank you very much, Naledi, and I would like to greet all the viewers at home who are actually watching this particular interview. No, thank you so much. Actually, this is the most important demonstration that maybe one can characterize as the most fundamental human rights, I would say justice, if you like. I mean, we've got people who are actually affected by, cancer, and also who are dying. And there's money that has been set aside. Unfortunately, the arrogant government is unable to spend that money because it is not considered to be their apex priority. Therefore, in line with the constitution of this country, Section 27, subsection 1, which says everybody must have access to treatment, to healthcare, and also the sexual and reproductive health rights. So this is the most important. So we want to push government to actually spend this money. I mean, you can't have over 3,000 patients who are dying, who are on a waiting list for years, yet money is there. It's just that we have a problem of political will and lethargy.
So why is the money not being spent in your view? You talk about how you've got the sense that cancer is not a priority for government. What is?
Actually, we have arrived in that determination because from 2021, this struggle has been protracted up to where we are today, with now this 784 million rand that has been set aside to respond to cancer and also to ensure that resources like radiation oncology services are in place. Therefore, that's how we arrived in this particular determination. And I mean, honestly, we want this money to be spent as soon as yesterday, if you like, because people are dying while on the waiting list, and there's no move. The department is not even willing to act with speed in terms of addressing this particular issue. So this is a major problem, which actually, put us in a very precarious position. So we want this money to be spent on outsourcing radiation oncology services, and also to ensure that at least people are able to receive these services and be able to save lives.
Yeah, so you've got Mayor, I think it's Mapipa with Treatment Action Campaign and also with Section 27. So a few civil society organizations that have come up on this issue, and they've written a letter as well. And this is interesting because what they talk about here, Monwabisi, is just the delays in procuring the sort of equipment that's necessary as well to treat cancer. I mean, talk to us about just how big the shortage really is and what the delays are. I mean, where there is the opportunity just to procure and ensure that the machinery is available, what is the hindrance that you're getting?
Actually, the hindrance based on the correspondence that was actually shared with the organization that we have mentioned, which is Treatment Action Campaign, Section 27 and Cancer Alliance, was that, the machines have broke down. Therefore, they needed to procure new equipment. I'll give you an example. In Charlotte Maxeke, around 2020, we had about 7 machines, oncology, radiation oncology, machines. Yes. But now we're left with only 2. And then we then said, okay, if this is the situation, therefore, in the meantime, as a short-term intervention, just go and look for a service provider that is competent, that will be able to bridge the vacuum while you are still now going to employ a long-term strategy to procure other equipment that is going to give the state, the sufficient capacity. Unfortunately, that has not been forthcoming. That is why now we are angry and even saying these people are not even taking us serious, including the people that are actually, infected with cancer. And that's why we are now actually, we're no longer flabbergasted, but now very angry to say these people are not taking this matter very serious. So the issues on procurement of the equipment and including the lethargy of not actually, outsourcing the services to push this particular long waiting list.
Yeah, I mean, one wonders if the issue was who essentially would get that contract to supply the equipment. And that's the concern, if that is one of the delays. I know that you are marching for the over 3,000 patients in Gauteng that are waiting for treatment. Talk to me about one or two of them, because when we say 3,000, we're giving a very big number. But when you start talking about one individual person who's hoping for medication that can save their life, hopefully that can drive, the story home. So talk to me about some of the desperate situations that these patients are in.
Okay. Actually, here, when we are saying 3,000, actually it's over 3,000. And those are not just mere statistics. Those are warm bodies. Those are warm bodies and are people who are living below, the poverty line. These are people, some of them are unemployed. These are people who are actually, not let alone being deprived, but these are people who are destitute. These are people who cannot have any other alternative to seek assistance outside of the public healthcare, sector. So these are people who are actually have become a burden in their own families, in their own households as well, and are hoping that actually one day there will be these services and their lives will be actually saved. So that's how desperate the issue is. So we're not just talking about statistics, but these are warm bodies which you are going to find in the townships. Most of them are within the bracket, quote unquote, working class. And these are people who are actually oppressed by the current status quo of the economy and are desperate at home. These are very serious, disheartening issues. I mean, if I can even use the example of Saturday, where we were celebrating 30 years of democracy, yet people cannot afford to actually, have an alternative, to access healthcare services, despite the 30 years that we're on in democracy. I mean, these are people who are downtrodden, if you like.
We're talking just about Gauteng. That's what's interesting here. We know that in previous years, provinces like KwaZulu-Natal have had massive shortages in how they're able to deal with cancer, particularly around breast cancer, right? Women unable to get mammograms as a result of those machines simply not being available, and then the shortage of oncologists in the province. What are you hearing from your colleagues in other provinces? I mean, Gauteng is essentially the most industrialized province in the country. So if Gauteng has a problem, what's happening in the other provinces?
The situation is dire. It's quite dire. And we communicate with our colleagues from time to time, including the leadership that we have spoken about, at Cancer Alliance, which is our fraternal organization as well. I mean, the situation is dire. But the reason we're focusing on Gauteng right now is that this struggle has been started around 2020. And we are very fortunate that we're able to negotiate successfully with the treasurer of Gauteng. That is why we're now talking about a 780 million rand that has been set aside. So that's a very peculiar situation that we find ourselves in. Money is no longer a problem. You can therefore imagine other provinces like KZN, after they've been hit by natural disasters, the extreme weather conditions and, matters of the July unrest and all those. So obviously resources will always have competing, I would say commitments. But here in Gauteng, it's a different story altogether. And therefore we can all imagine and prefigure how dire the situation is in other provinces, the degree to which those people find themselves, because the issue of incapacity, including the human resources, included in that, actually, in that deficiency, it then compounds the situation. Then it becomes a nightmare. I
want to actually remind our viewers of a discussion that we had here on AM Report in March, just at the beginning of last month. And one of the things that we touched on was how health departments in various provinces had underspent their budget. In Gauteng, they had underspent by 2.7 billion rand. The Northwest, 200,000. I'm not going to go through all of them. The Eastern Cape, 62 million. And the numbers go on and on and on. So a serious concern on money that could be helping to save people's lives and somehow not being used. What is it that the Treatment Action Campaign can do beyond marching and having these discussions in the media to hold government accountable?
It's quite bizarre, actually, to even return money in the sea of this destitute environment we live in. Then it tells you that we've got wrong leaders. Actually, we need to find other leaders that are going to, have an emotional attachment in the sufferings of ordinary people and be able to transform the situation. So as Treatment Action Campaign, we are emphatically engaged in the process of engaging government, holding government accountable. And I think one thing that you would be aware of, which we are notorious for, is to actually go to the streets. We are able to actually, go and spend days in the office of the Premier. It was David Makura then. We spent 3 days, very chilly nights there. That's part and parcel of holding power to account. And then behind the closed doors, we are having series of engagements with the duty bearers at all levels, and to try and engage them, actually to say it is unlawful to understand and want to achieve narrow, selfish, gratifications, good auditor generals, auditor, outcomes and all those things. We care less about that. So, but the process and also the trajectory of accountability, it's unambiguous when it comes to treatment action campaign.
Yeah, well, we'll be watching for the march throughout the day, and of course, keeping a close eye on how far you're able to get as you share that memorandum with the health department here in Gauteng. That there was Treatment Action Campaign chairperson in Gauteng, Monwabisi Mbasa, speaking to us there. We're going to take